How to prevent HIV. Essential steps for protection. HIV, human immunodeficiency virus, is a virus that attacks the immune system, making individuals more vulnerable to infections and certain cancers. While there is no cure for HIV, it is possible to prevent its transmission and live a healthy life. Here are some important steps to help reduce the risk of contracting HIV. 1. Use condoms consistently and correctly. One of the most effective ways to prevent the transmission of HIV during sexual activity is by using condoms. Both male and female condoms are available and should be used every time you engage in vaginal, anal, or oral sex. Proper use of condoms significantly reduces the risk of HIV and other sexually transmitted infections, STIs. 2. Consider pre-exposure prophylaxis, PrEP. PrEP is a medication that people at high risk of HIV can take to prevent infection. When taken daily as prescribed, PrEP can reduce the risk of getting HIV by up to 99%. It's especially recommended for people who have an HIV-positive partner or those who engage in high-risk behaviors, such as unprotected sex or sharing needles. 3. Limit the number of sexual partners. Reducing the number of sexual partners can lower the risk of exposure to HIV. Engaging in monogamous relationships, where both partners are HIV negative and mutually faithful, helps minimize the chance of HIV transmission. 4. Get tested and know your partner's HIV status. Regular HIV testing for yourself and your partner is crucial for prevention. Many people with HIV may not show symptoms for years, which means they might not know they are infected. Getting tested regularly allows you to know your status and make informed decisions. If one partner is HIV positive, treatment, such as antiretroviral therapy, can help lower their viral load, reducing the risk of transmission. 5. Avoid sharing needles or syringes. HIV can be transmitted through sharing needles or syringes that have been contaminated with the blood of someone with HIV. People who inject drugs should never share needles and should consider using needle exchange programs, which provide clean needles and help reduce the risk of HIV and other bloodborne diseases. 6. Post-exposure prophylaxis, PEP. PEP is a medication that can be taken within 72 hours after potential exposure to HIV, e.g., through unprotected sex or needle sharing. When taken as prescribed, PEP can prevent HIV from taking hold. However, it's important to start treatment as soon as possible for maximum effectiveness. 7. Ensure safe blood transfusions. In many countries, blood donations are tested for HIV and other infections. However, in regions where testing protocols are not in place, it's important to ensure that any blood transfusions or organ donations come from reputable sources. The risk of HIV transmission through blood transfusions is very low in places with proper screening procedures. 8. Education and awareness. One of the most powerful tools in HIV prevention is education. Knowing how HIV is transmitted and what steps to take for protection empowers individuals to make safer choices. Public health campaigns, awareness programs, and discussions about sexual health play a significant role in reducing the stigma around HIV and helping people protect themselves. Conclusion: preventing HIV is possible through awareness, education, and proactive measures. By using condoms, considering PrEP, reducing risky behaviors, and getting tested regularly, you can greatly reduce your chances of contracting HIV. Remember, early prevention is key to leading a healthy and fulfilling life, free from the risk of HIV.